How do NSAIDs increase diverticular bleeding risk? Imagine taking a common painkiller and unintentionally increasing your chances of bleeding in your digestive system. That's what happens with non-steroidal anti-inflammatory drugs, or NSAIDs, when you have diverticular disease. These medicines can weaken the protective lining of your colon, making blood vessels in diverticula more vulnerable to injury and bleeding. NSAIDs work by blocking enzymes called cyclooxygenases, or COX enzymes. These enzymes are responsible for producing prostaglandins, which are natural compounds that help protect your stomach and colon lining. Prostaglandins promote good blood flow, mucus production, and bicarbonate secretion, all of which keep your gastrointestinal lining healthy. When NSAIDs block these enzymes, prostaglandin levels drop, leading to a weaker mucosal barrier. This makes the colon lining more prone to damage from normal digestive processes or minor injuries. In diverticula, which are small pouches that form in the colon wall, blood vessels are often located within or near these outpouchings. When the mucosal protection is compromised, these vessels become exposed and more likely to rupture. This rupture causes bleeding, which can sometimes be significant. Additionally, NSAIDs can impair how platelets work. Platelets are blood cells that help clot and stop bleeding. Some NSAIDs, especially aspirin, inhibit platelet aggregation, making it harder for your blood to form clots after a vessel is injured. This can lead to more prolonged or heavier bleeding episodes. NSAIDs may also promote local inflammation in the colon. This inflammation can weaken the walls of diverticula further and increase the risk of vessel rupture. Studies have shown that people who regularly use NSAIDs or aspirin tend to have a higher risk of experiencing diverticular bleeding. The risk increases with higher doses and more frequent use, meaning the more you take these medicines, the greater your chance of bleeding. It's also worth noting that NSAID use might increase the risk of developing diverticulitis, which is inflammation or infection of the diverticula. This can complicate the disease and make management more challenging. Because of these risks, healthcare providers often advise people with diverticular disease to use NSAIDs cautiously. Alternatives for pain relief or inflammation control might be recommended to reduce the chance of bleeding or worsening the condition. In summary, NSAIDs increase the risk of diverticular bleeding mainly by weakening the colon's protective lining, exposing blood vessels to injury, and impairing clotting mechanisms. This combination makes blood vessels in diverticula more prone to rupture and bleeding. If you have diverticular disease, it's important to discuss medication options with your healthcare provider to keep your digestive health safe. Always seek personalized medical advice to find the best approach for your individual situation.